Welcome to the Nat Health Leadership Reach Out series. This is a unique program where the doyens of the industry engage with the frontline health workers, our COVID heroes, and offer their advice, mentorship, counseling, and support. It's indeed a great privilege on our part to have a doyen of healthcare today with us, Honorary Brigadier Dr. Arvind Lal, Padma Shri, Executive Chairman, Dr. Lal PathLabs Limited, former President of Nat Health and advisor of FICCI's Healthcare Services Committee and former Chairman. Very welcome to you, sir.
Thank you.
Brigadier Arvind Lal is a pioneer in bringing laboratory services in India at par with the Western world. He's an alumnus of the Armed Forces Medical College, AFMC Pune. In 1977, Brigadier Lal took charge of Dr. Lal PathLabs, the medical diagnostic laboratory founded in 1949 by his late father. Under his expert guidance and leadership, Dr. Lal PathLabs has become one of the most reputed laboratories in Asia, having to its credit a record of 32 labs accredited from NABL, and he has brought international recognition to the Indian healthcare industry in the form of accreditation from the College of American Pathologists, CAP USA. Currently, they operate nearly 216 labs, including Asia's biggest lab at Rohini, New Delhi. The lab tests over 70,000 patients every day. In 2020, Dr. Lal PathLabs tested nearly 20 million patients. In the ongoing COVID pandemic, the labs have already tested more than 1 million patients by RT-PCR. Dr. Lal was the former president of Nat Health. He is currently the chairman of FICCI's Swasth Bharat Public Health Task Force and is the outgoing chairman of FICCI's Health Services Committee. Awarded with the Padma Shri in 2009, Dr. Lal is also the first civilian doctor to be granted an honorary brigadier's rank in Armed Forces Medical Services in 2009. In 2015, under his leadership, his company had one of the most successful IPOs in the history of the National Stock Exchange. In 2016, All India Management Association, AIMA, conferred on Dr. Lal the Entrepreneur of the Year award. In 2017, Dr. Lal was confirmed with the Lifetime Achievement Award by Federation of Indian Chambers and Commerce, FICCI. In 2019, Dr. Lal was inducted in the prestigious Hall of Fame by the Armed Forces Medical College, Pune. He, along with his CEO, were awarded the ENY Entrepreneur of the Year Award 2019 in healthcare. He was also awarded the honorary degree of Doctor of Philosophy, PhD, by honoris causa by Rai University. A very, very warm welcome, sir. It is indeed a pleasure to have you.
Thank you. Thank you.
Sir, as you are aware, this series conceived and designed by Nat Health brings the questions, the voices of the frontline health workers. We are very honored to have some of these questions being reflected upon, answered, and we look forward to your guidance through this session. We have a list of questions which we have collated beforehand, but as the session goes underway, we may also have some live questions and we'll add on to this. We intend to keep this session as interactive as possible. Sir, the first and the opening questions, we would like your guidance on is really around the fatigue and the stress that this COVID has been building for the last year or more than a year. What are your advices in the way the frontline workers, the professionals can cope with the stress that is being built out day in and day out? Any advice, sir? Over to you. Thank you.
So what I would like to do is, give you my own thanks to Dr. Harsh Mahajan and to you, Siddhartha, and the entire Nat Health team for organizing and inviting me to this interaction with health professionals. I wanted to do this work because it's a calling. And this is the most common response when anyone working in healthcare is asked why they chose to be in this profession. To most of us, caring comes naturally, and to serve others, we go beyond our limits. But what do we do when the healers need some healing? That is a question. Healthcare workers have been at the forefront of the battle against COVID-19 worldwide treating and saving lives of millions of patients every day. In India alone, approximately 30 million healthcare professionals and frontline workers are engaged in COVID care and management. However, scenario in India is witnessing the second wave of infection, as you all know, with the peak almost 4 times more severe than the first wave's peak. And this is akin to war. Experiencing loss and trauma on a daily basis has taken a toll on the mental health of all healthcare professionals. Some degree or the other, we are all affected. And we are suffering from stress, anxiety, fear, depression, and difficulty in sleeping. A doctor was quoted as saying, quote, "I am anxious when I'm there, and I feel guilty when I'm not. I feel like I should always be thinking about it," unquote. I can completely relate to this, and I'm sure so many others here. There is a scarcity of essential resources in the country that includes testing kits, testing facilities, hospital beds, vital drugs like oxygen supplies, ventilators, etc., and above all, human resources. This burdens the healthcare professionals with rationing life-saving treatment among critically ill patients, which is literally having to decide who lives and who dies. In addition to the lives of healthcare workers lost due to getting infected with COVID in their line of duty, we are losing doctors and other healthcare professionals to adverse form of mental trauma, leading to suicides sometimes. This, according to me, is the most unfortunate part of this pandemic. I urge all healthcare professionals not to ignore their mental health. Even before COVID-19, burnout and depression were common in healthcare professionals than in any other professionals. But still, we tend to be reluctant to seek help for mental health problems due to worries about confidentiality, stigma, and the fear of derailing one's career. And above all, in India, we tend to put all these things under the carpet. In this hour of crisis, it is also very critical for leaders in healthcare to plan and provide psychological support, facilities for distressed workers, and also make them, get them timely help, ensure they feel safe and cared for, appreciate their efforts regularly, openly communicate and discuss the situation and challenges, and relieve them from as much legal liability as possible. So, Siddharth, I'm ready for your first question, please.
Absolutely, sir. Sir, thank you for that introduction. As a top industry leader, what are some of the key warning signs or the signs of adverse mental health, in your opinion, that healthcare workers should be aware of in their day-to-day lives? That would be, sir, the first question, if you can kindly enlighten us. Thank you.
So I would like to start, from being stressed in an unprecedented time like this is inevitable. But being alert about one's physical and mental health warning signs can help in nipping the problem in the bud. Some key warning signs of adverse mental health that we must all watch for include overreacting to situations, getting agitated, feeling helpless, what they say, feeling of gloom and doom, finding it difficult to relax, losing interest in what you normally like to do, feeling worthless, fear without any triggering mechanism. And some of the physical signs, which I'm sure each one of us has suffered, is dryness in the mouth, breathing difficulty in the absence of any physical exertion. You start breathing, slightly fast, trembling of hands you have seen, and unexplained aches and pains in the body. So individual thresholds will definitely vary, Siddharth, but if one experiences one or more of these above signs regularly, that is a time to seek help. And I again appeal to all my brethren in the healthcare industry, not to put these things under the carpet, to take them out, talk to your loved near and dear ones, and discuss. And it's no secret that most of the big hospitals these days also have a psychiatry department. Or you can ask for some people who've been there. For example, the senior people, they have gone through these stresses and strains very much often. But I must also share with you that this kind of a situation is faced once in 100 years. Last time people or Earth saw such kind of a problem was between 1918 to 1920. Now, ladies and gentlemen, 100 years have passed. So this has come out of the blue. But this is what our own Indian culture is absolutely geared to stand with. The Western culture is not so strong as far as mental health is concerned. I think we are stronger. Yes, Siddharth, your second question, please.
Sir, you have talked about it's a once in a century crisis. Fatigue, stress is natural. What are some of your advice in the way the community as a whole can deal with this stress and these warning signs? What are the top few things that come to your mind, sir?
Well, first of all is that you have to share with somebody. So what I have just said earlier also, I'm reiterating that please confide in a trusted colleague or a family member regularly to discuss what is really bothering you. This is not something which you should always keep on adding into your heart, because one fine day it will not be worth it. And you should also seek support, as I said earlier. Being in the healthcare sector, you have access to medical professionals in your work circle who will do everything that they can to manage your stress and anxiety. Also, the next thing which you must remember is to pace yourself. Don't push yourself just like as if you're running a race. Understand the tasks expected from you properly and pace yourself to perform these tasks. Remember, it will take time for the situation to get better, and this will not happen overnight. To last the whole duration will take long time. You have to understand your own capabilities and constraints to work efficiently. Remember that saving lives is a noble cause. Keeping yourself motivated and motivating others also is even nobler. And you must also understand that once you have done your job, you have done the mechanical part, you fitted the ventilator, mask, etc. The patient is now comfortable where he was gasping for breath. Now let the body also take its own time in healing him. You remember that old adage that I treat, he cures. So please remember that. You are not everything. Don't get out of hand. And spiritual practice also, again, for which, I'm on Indian turf, so I can, talk about it. Now, this is my personal recommendation that I follow religiously. You simply cannot fathom the power of meditation and chanting of the God's name, whichever God you may believe in. If it is Lord Shiv, repetition of Om Namah Shivaya. If you are a believer in Ram, Ram Ram, or if you are a Sikh gentleman, Satnam Shri Vaheguru, or even the Jesus Christ mantra, Om Eem Isa Masih Devaya Namah. And meditation is now also recognized in Harrison's book on internal medicine as one of the things to alleviate hypertension. So what I'm saying is something which is time tested by me personally, and that is meditate on a mantra. Like I'm a Shiv follower, so I close my eyes, look in the center of your two eyebrows, and keep imagining Lord Shiva here, and slowly but steadily keep on repeating Om Namah Shivaya, Om Namah Shivaya, Om Namah Shivaya. You will see in a reasonable amount of time, your breathing will become normal, your anxiety level is gone, and you will feel much more relaxed. And after a few days, this kind of a repetition becomes a habit, and you have to learn to live with that habit. So, next thing which I would strongly recommend is that you should get out of your house and get some exercise. Now, there are two types of exercises. I am now first saying about the aerobic exercise. Aerobic exercise includes walking, cycling, workout, skipping, climbing stairs, doing swimming, stretching, yoga. But yoga is very good to make your body supple. It will become more flexible. Especially for people in our age group, that is very important. But it should not be confused with an aerobic exercise, which I have just told you, are walking, swimming, running, climbing steps, skipping. So this exercise plus the spiritual mantras which I have just told you, this makes a very deadly combination. And I can assure you that your anxiety levels will start to fall, absolutely by crisis. So that is what I feel will happen to you. Yes, Siddharth.
Wonderfully put, sir. Sir, in your opinion, what are some of the things that hospitals and labs today are already doing to support this fatigue factor, stress factor for frontline workers? And what more could be done in the days and the weeks ahead, sir?
Okay, I'll try it. So protecting the staff from physical impact is always easier and hence should be done in a foolproof manner. We must ensure zero breach of safety measures. So safety always comes first. So which means that there should be an adequate supply of PPE, protective material, masks, goggles, gloves. It should be accessible to the entire staff. There should be no staff, which should be without these, if he's in the same ward, without any of these implements. Getting the employees now vaccinated, because I would like to reiterate, you may do anything in your life, but if you don't get vaccinated, you are playing with fire. And especially people who are in the elderly age group, people suffering from some kind of heart disease, high blood pressure, diabetes, some kind of, brain problems like strokes or, lung problems, etc. For them, it is mandatory that you should please go and get yourself vaccinated. And also about vaccination, since we are dealing with it every day, there are two vaccinations to be done. One is if you're taking Covishield at 0 day number 1, and you have to get it done again after now 90 days, 90 days, 3 months. That is what the government has recommended. And you can even go to 4 months, but I would prefer 3 months. And give yourself at least 15 to 20 days after that, or maybe a month. And then you will get a fair amount of degree of protection. So going on to my original topic, now you ensure that your sound mental health, achievement is tricky because in India, we do not proactively talk about mental health issue levels. We by nature are very, very, I would say, we don't want to tell anybody that this is something which is bugging me or bothering me. So we should come out with it. In fact, there is a stigma attached to it also. First of all, this needs to change. And employers have to place a proper system for healthcare workers to access their mental health, whether they do it using in-house resources or by providing access to experts outside the organization. All employees must be able to seek mental health advice and treatment, and without the fear of negative impact on their professional path. In the same breath, I will also advise all the HR, the entire HR department now, should take on this role of doing, some kind of a mental massage. In my days when I was studying in college, there used to be an advertisement on Vivid Bharati, Iodex Malo, Kaam Pe Chalo. So this kind of a mental massage now the HR department must do in some form or the others. I've already enumerated what I do personally, but they can actually handhold a person and say, with looking him in the eye, don't worry, nothing is going to happen to you and nothing will happen to you. Yes, Siddharth.
Sir, we spend almost our entire day now on digital gadgets and the term, the Zoom fatigue or whichever tech platform we use is setting in for a large number of, healthcare managers, administrators. What are your suggestions, sir, in the way we balance this new digital world and so that we don't lose touch of what really matters, which are the people level interactions?
So I'll give you a one-liner first. Now that Zoom has come into our lives, it shouldn't be that you keep on zooming till either the Zoom breaks or you break. But on a serious note, I think I'll add here that ever since COVID hit, virtual meetings have become an essential part of our work lives. Their numbers have skyrocketed with billions of Zoom calls happening, practically, not every day, millions happen every day. And across the world, and there are different platforms, so much so that people are exhausted from these calls, and the term Zoom fatigue has been coined now. Video conferencing is definitely a good thing for remote communication, but we must understand its limitations and the stress it causes. Of course, very long-term, studies will come out that what actually video conferencing did, and more importantly, what it did not do. We need to assess and follow a few practices when using video conferences, which can be summarized as limit the number of meetings per day. It's not like a 9 to 12 and 12 to 3 and then there's a matinee show and 6 to 9 and there's a night show. Sorry. So you've got to, be constantly at it, fine, but you can time them. Balance the video conferences or meetings with calls, telephone, please pick up the call, and text-based communication also. You'd be surprised at what you can talk sometimes on the telephone. Take you a few seconds, few minutes. You don't have to get zooming in every time. And of course, this is another thing which, I've never seen myself, so constantly as I do during this, video chat. So avoid seeing yourself during video chats, constantly. That's another thing. I know you were always a nice guy, but you have to keep on telling yourself that every moment is not all.
Correct.
So always have a pre-decided agenda for the meetings and stick to timelines. And this is on a very serious note that we in India would like to talk about so many things. But here, when you are having Zoom calls, please stick to before you go on Zoom, agreed agenda, and stick to the points. And again, I am not blaming anybody, but we Indians love to chat. We love to hear our own voice. So please learn to shut up when you have made your point and let the other person speak. Wonderful. So allow yourself, lesser screen time. And that also is a practice. And these are certain, Zoom call or video call etiquettes, which I'm saying that should be coined now. Maybe Nat Health, can take a lead. That these are the do's and don'ts of having a good, nice, wholesome, healthy video chat. Siddharth.
We'll take your suggestions on that one. Sir, I think the next question that has come in is really around the fact that really looking ahead, the exact path of the virus is going to be unpredictable, but do you foresee some development, new developments in the India's response, the infrastructure augmentation, which will alleviate the current stress and the pressure that the healthcare workers are finding? How do you see the next 3 to 6 months pan out, sir, and the road ahead?
I think that's a very good question. And we have to acknowledge, Siddharth, that both the government and the private sector have been constantly trying from the word go to expand the healthcare infrastructure and resources to support, such infrastructure. Whether it is COVID testing or creation of extra hospital beds or getting more ventilators or drugs, vaccines, and now even medical oxygen, we have been able to scale up rapidly. Unfortunately, we always start a little late, and our approach is more reactive than proactive. And if I may also add that we Indians must be able to look ahead, plan ahead. It is not a pressure cooker situation always that we should always come show our best. See, we came out with flying colors at that time. Why can't we plan like other countries? And to start with, I think, and Siddharth is already smiling because he knows what I'm going to say. How about spending some more extra money from the government's part on healthcare? So, while infrastructure and physical resources can be ramped up infinitely, the human resources for healthcare, who are critical cog in the COVID response, cannot be created in a short time. That's for sure. To augment healthcare human resources, Some states have made exceptions by allowing medical students, nursing students, and even Ayush students or Ayush doctors, uh, the students who are in their final years, you have, I think, all read about it, to work in hospitals providing COVID care. I think this is a step in the right direction. And as the second wave dies down, vaccination rates will increase, hopefully, and lockdowns in highly positive areas are implemented. I'm optimistic that the pressure on our health system and healthcare workforce will gradually be relieved. So don't worry. After a night, there's always daytime, sunrise. And after the tunnel you have entered, there's always the end of the tunnel. So this time will pass. But the fact of the matter is that you and I should now be able to live with it. Siddharth.
So I'm just taking some questions that are coming in, and I think one of the questions is really around the testing and the diagnostic sector. If you look at from last year, where there was a blanket national lockdown, and this year it is much more contained, much more, the containment zones are ring-fenced based upon, to a large extent, the surveillance data that is being given out by the testing and the diagnostic industry. So in your opinion, how can the testing and the diagnostic sector be made more robust as a lesson out of this pandemic? What are some of the things we need to work with government to achieve, both during the pandemic and thereafter, to make sure that testing is a privilege that is universally available to everyone in the country?
So, Siddharth, the fact of the matter is that right now, when we had hardly one testing lab at the starting of the pandemic, now we are talking of in excess of 2,500 labs. And I'm happy to state that 60% of them belong to the private sector. Like everything else in India, 70% of the OPD patients are treated by the private sector. So I'm very happy that private sector has not been found wanting, and it has risen to the occasion. But I must also compliment the government, and especially ICMR in this case, and especially Dr. Balram Bhargav, who had the wherewithal to think through, and he brought all these labs under one portal very quickly. And of course, NABL rose to the occasion. There were hardly any labs that are doing this kind of testing, and NABL worked day and night. This fact is not known to everybody. NABL, because each lab doing this RT-PCR testing had to be NABL accredited. So NABL has accredited literally thousands of labs. And at the same time, I would also now request that since the private labs have come up to a certain level, and as you know, RT-PCR is a gold standard in the world, so there's no better test than this. I would also request the government to start accreditation of its NABL labs. So that is one part about the quality. The second part where we can do much more is that the private sector and the government sector, that is the governments, they must be able to shake hands more often. As they say, there's a saying in English that you cannot shake hands with a closed fist. So you've got to open your fist, got to open your hearts, and you have to sit down and discuss the problem. The discussion or the finding a way forward is unfortunately, again, this is a part of the Indian culture. It is us versus them always. This should come down. And we should be able to sit with each other in a nice open atmosphere where we can think ahead. Today, Dr. Lal PathLabs has done in Delhi 15,000 RT-PCR tests. And all over India, we do another 15,000. So this could have been ramped up to even 100,000 tests per day if the need arose. But for that, I have to be sitting with the government and making them understand this is what I require. And the government also in an open atmosphere telling me this is, Dr. Lal, what we would wish for. If the facilities are there in India, I'm sure they have been created to be used. Next thing which I would like to emphasize also is that when you create things in a hurry, in a jiffy, as they say in English, then as soon as the pandemic comes down, what do you do with that infrastructure? So you have now got to be slightly more, deft in your handling. You've got to be quick on your feet, that you should be able to set up these kind of labs or these facilities, in a temporary kind of a manner. And as soon as the workload goes down, you have dismantled them. But just like the Indian Army, you are about tomorrow, if there's a third wave, yes, I should be asked by the Chief Minister or Health Minister of Delhi or by the center, Dr. Lal, we want you to ramp up your testing by another 10,000 tests. Which day will you be ready? And Dr. Lal can look them straight in the eye and say, sir, give me 3 days. And that's it. So that is the way I look at it.
Sir, as the virus is now taking grip in the rural parts of India, it is now moving from the urban into the peri-urban and the more remote corners of the country. There is, of course, a need to boost up testing and surveillance, beyond the cities. Dr. Lal, PathLabs, is one of the pioneers as far as public-private partnerships are concerned. In your opinion, sir, in the remote parts or the rural parts of India, what needs to be done to augment the testing infrastructure, and what role private sector should take?
Since I am handicapped by only offering testing services, so the testing services is at the second position. The first is provision of primary health in the rural areas right now when they need them. So for this, the primary health sector of the government, which consists of the health and wellness centers, primary health centers, and everybody, and even extra help, should literally go and find out through their intelligence or even door-to-door survey that who is well and who is unwell. Because a person who is not well, who is having, say, I'm just saying that he's got loss of smell, he's got loss of taste, he's got fever, he's had difficulty in breathing, you have to be, very quick in isolating him. And please put up, as what I just described, a temporary kind of, army style. You put beds and oxygen and you get those people. And he's isolated so that the other people in his family, they are also protected. Then comes the role of Dr. Lal. And I will go and test him in the field. And anybody who's symptomatic will, favorably, give me or I can test him on a rapid antigen test. But people who are asymptomatic, they may not show, they may be actually positive with the virus, but the rapid antigen test may not be able to pick it up. So again, fall back to, number one, and that is RT-PCR. So if there is a judicious mix of rapid antigen testing and RT-PCR testing, I am sure, Siddharth, we can lick this problem even in the rural area.
Wonderful. Wonderful, sir. Sir, we have the last two questions that have just come in. One is really around this, in the middle of a pandemic, the issue around medical violence, the way it is coming up. There is a real need, for the safety and security of the frontline health workers. What is, in your opinion, sir, the role of all the stakeholders to ensure that the frontline workers have a safe and a sound infrastructure and an environment in which they can genuinely take care of the patients?
So this has been, brought up by us in many fora even before the COVID-19 came in. And that was that even when there is an adverse, reaction, adverse death of a patient, we can't save them all. As I said, I treat, he cures, so we can't save them all. So at that time, it was decided that there's some kind of a police protection will be provided, and there'll be kind of a quick number, like a number 100, some extra number given like this, in which the police can be there at the site of violence in no time. This is something akin to a rapid action force. I'm again repeating, the government has, not acted on this the way we wanted, the medical fraternity wanted to act, but they must be able to give that kind of solace and that kind of confidence to the healthcare workers, whether they are doctors or the ward boys, everybody in the thing. And there should be some kind of a, resolution to this sooner than later, Siddharth.
Wonderful, sir. So the last question absolutely is a poignant one, and it's from a health worker who is asking, in spite of giving our best, in case we are not able to succeed in saving a patient, and could be because of any number of factors. How do we cope with that? How do we reconcile with that? And how do we overcome that guilt that may set in?
I think most of the doctors are, very, very tuned to answering this question, because India being a large populated country, and we lose some, we save a hell of a lot, but we also lose some. So what you are mentioning is not something which is out of the blue. As I just told you that I have before we started, that I have personally lost 5 medical classmates of mine, four gentlemen, and one was the wife of a doctor. That close. Every day there is somebody whom I know who is no more. Like Dr. K.K. Agarwal, he was a member in this committee also. So what I'm saying is that if you have done, the state has done its best, that given the good infrastructure, and there was a patient who did not die for want of an oxygen mask. He did not die on the way from the ambulance to the bed, and there are adequate beds. So there are few things which doctors cannot do. The government has to provide, or the providers have to do it, and let the doctors do their own work. And what I'm coming to is that once you know that the patient's relatives, who are the ones who are going to cry for the patient who has gone away, they will see that they did everything, that the ambulance is there in no time. There was a stretcher waiting for us the moment we reached. He was wheeled into the bed at no time. Doctor was available in no time. Oxygen was started in no time. Doctors fought like mad day and night. And on the 5th, 7th, or 10th day, the patient died. No patient's relative will come and question you.
Correct, sir. Absolutely. Very well said, sir. Sir, we're almost at the end of this discussion, but as NatHealth, as this community, what are some of your words of wisdom in the areas we should focus upon during this pandemic and beyond, which helps the frontline workers and really brings together, the end to this suffering that everybody is facing? Your words of wisdom, sir.
There is no magic words of wisdom here. So I think the healthcare workers must also realize that, the science is only a good science. There is no bad science. So the science is telling everybody, and I'm answering this question because I keep hearing even from healthcare workers, should we get ourselves vaccinated? Should we not? What should be the interval? Should I do co-vaccine? Should I do this vaccine? Should I wait for something? I know a doctor who waited for some other vaccine to come and hit India, and he died. I'm telling you today. So what we need to do is that you just do the right thing at the right time. And today, if you are a frontline, COVID worker, we hope that you have been, vaccinated. Both the shots have been given. Ample time has passed after that. And also secondary, you are wearing all the PPE, that you are not going and looking after a COVID patient and saying कि मुझे तो vaccine लग चुकी है, मुझे कुछ नहीं होगा, नहीं, ऐसा कुछ नहीं है. And I want to reiterate in this forum also that after 2 vaccinations and 15 days after that, you can still get infected. You can still die. So do not, test the virus too much. Thank you.
Sir, we are deeply grateful for you having taken this time, your words, what you have shared, your ideas, what we have shared. We have recorded this session for those who were not able to join us today. We will be transcribing a lot of the questions with the answers, sir, what you have kindly provided us. And it is going to be NatHealth's endeavor that each of the suggestions and the answers reaches as many of the healthcare workers as possible, not only within the NatHealth community, but other federations that partner with NatHealth. So with those words, I would like to thank you from the bottom of all our heart. You have been a champion of everything that we do in the industry. Your support for the frontline workers, your encouragement means a lot. And we hope to continue these discussions in the days and the weeks ahead. Thank you so much.
And thank you so much, Siddharth. And thank you, NatHealth.